Good day everyone, my name is Juan Miguel o Apat, and today I'm going to perform cardiovascular system. For the equipment, we're going to use stethoscope. Procedure number 1, assess the client's physical and psychological aspect before and during examination. Rationale, allow healthcare provider to gather complete data about the client's health status. So good day ma'am, may I know what is your name?
Apat.
Thank you. Next is review the body areas to be examined. Rationale, help examiner to identify the body areas to be examined systematically. Next, procedure number 3, make a physical and environmental preparation before examination. Rationale, proper preparation of environment, client, and equipment ensures smooth physical examination with less interruptions. For procedure number 4, gather and take the health history of the client. Rationale, talk of comparison from previous illnesses to present health condition. So good day ma'am, may I know kung meron po kayo mga previous na sa illness like ubo po ma'am?
None.
How about chest pain po ma'am?
None.
None naman so far, thank you. Procedure number 5, conduct a physical examination for the abdomen using 4 skill in assessment: IPPA, inspection, palpation, percussion, and auscultation. For the rationale, determine and identify abnormal findings on the body system. For the assessment, inspection and palpation of the heart. Procedure number 6, simultaneously inspect and palpate the precordium for the presence of abnormal pulsations, lips, or hip. Locate the areas of valves of the heart, like the aortic, pulmonic, tricuspid, apical, or mitral. For the normal findings, it should be no pulsations, no lips or hibs. For the abnormal, presence or pulsations noted, and diffuse lips or hibs, indicating enlarged right ventricle. So today ma'am, I'm going to inspect your ano po ma'am. Just inhale, exhale, inhale, exhale, inhale, exhale, inhale, exhale. Next is procedure number 7, palpate the epigastric area at the base of the sternum for abdominal aortic pulsations. For the normal findings, aortic pulsations. For the abnormal, bounding abdominal pulsations. Palpate lang po natin ang epigastric po na. Thank you. Next, assessment, auscultation of the heart. Procedure number 8. Auscultate the heart in all 4 anatomic sites like the aortic, pulmonic, tricuspid, apical, or mitral. In every area of auscultation, distinguish both S1 and S2 sound. For the normal findings, S1 usually heard at all sites, usually louder at the apical area. For the S2, usually heard at all sites, usually louder at the base of the heart. For the systole, it is a silent interval, slightly shorter duration than the distole, at normal heart rate of 60 to 90 beats per minute. And for the distole, it is a silent interval, slightly longer duration than the systole. For the abnormal, increase or decrease intensity and varying intensity with different beats. Increase intensity of aortic area increased intensity of pulmonic area, and sharp sounding clicks. Auscultate lang po natin, ma'am. Inhale. Exhale. Inhale. Exhale. Inhale. Exhale. Inhale. Exhale. Next assessment, carotid arteries, procedure number 9. Palpate the carotid arteries one at a time using extreme cautions. Rationally, it ensures adequate blood flow through the arteries to the brain. For the normal findings, symmetric pulse volumes, full pulsations, trusting qualities, then qualities remain the same when client breaths, turns head, and changes sitting to supine position. For the abnormal, asymmetric volumes, decreased pulsation, increased pulsation, thickening, hard beaded inelastic walls, indicating atherosclerosis. So, i-ano po natin, assess po natin ang carotid arteries niyo po, ma'am. Ano po tingin, ma'am? Kabila. Thank you. Next, procedure number 10. Auscultate the carotid arteries one at a time. Normal findings, no sounds heard on auscultation. For the abnormal, presence of root on one or both arteries. Assess po natin ang carotid arteries po. Kabila po. Thank you. Next assessment, jugular veins. Procedure number 11. Inspect jugular veins one at a time for distension. Normal findings, veins not visible, indicating that the right side of the heart is functioning normally. And for the abnormal, veins visibly distended, indicating advanced cardiopulmonary disease. So, i-inspect po natin ang jugular veins po, ma'am. Doon po magpunta, ma'am. Kabila po. Thank you. Procedure number 12. If jugular distension is present, assess the jugular venous pressure. For the rationale, the external jugular veins is more easily affected by obstruction at the base of the neck. For the evaluation, make findings on health assessment and physical examination done on the client. For the rationale, these are important data to convey the physician aid in diagnosis of the client. And for the documentation, record, document, and report any pertinent findings during assessment to appropriate personnel. And for the rationale, to provide accurate data in the care of the client. Now, we are done on assessing the cardiovascular system. Thank you for watching.